Everyone, it is wonderful to see everyone here today to celebrate some really significant progress we're making in the battle against COVID here in our county. And of course, our county has done an amazing job, and I'm grateful for the leadership of the folks who are standing behind me, President Cindy Chavez, Marty Fenster-Shive, who just came back out of retirement, failed miserably at retirement, but he's now heading up the testing initiative at the county. And of course, today we are talking about testing because this wonderful partnership between Verily and the state of California, we are today able to announce that anyone who wants a test, I'll say that again, anyone who wants a test can get tested here at Pal Stadium in San Jose. That is, if you are in the city of San Jose and you want a test, you do not need health insurance. You do not need to pay. You do not need symptoms. You can get tested here at Verily. This is a great moment for us as we are scaling the amount of testing countywide. That's critical for us as we try to reach the current goal of 4,000 tests a day. And under Dr. Fenster-Shive's leadership, we're really starting to see some great gains in that regard. Verily is a critical partner in that, operating 2 sites, one here at Pal Stadium, another at the county fairgrounds. They can handle about 300 tests a day. That's really important. And hopefully, if we can really demonstrate that we can bring people here, we're going to be able to scale capacity at these sites as well. This is an effort we've been all working on together. Really grateful for the hard work of our city team, led by Kip Harkness, who heads our Emergency Operations Center, Rob Lloyd, who in his day job is Chief Information Officer and runs all things IT, but now he runs a whole lot of other stuff in the EOC. Walter Lynn, the Public Works Department, and of course a lot of folks at the county. And I'll ask President Chavez to thank members of her team because I know she knows far better than anyone. But of course, it's possible because Verily has stepped up in a big way. And I know John Probst will be speaking in a moment about the work that his team is doing here to make it easy for folks. All they ask is that everyone sign up online. The website is currently in English and Spanish, and we're working with them to try to see how we can continue to make it more and more accessible. Really grateful for everyone, the Verily team and their parent company, Google/Alphabet, Javier Gonzalez, who has been working with us day after day to figure out how we can continue to expand testing here in San Jose and countywide. Ruth Porat and everyone who has been so responsive to our request to see how we can serve more of our residents. We know that where the data is telling us the need is. It's here in East San Jose. It is here where we are seeing a disproportionate number of deaths, a disproportionate number of cases. That is a factor of, frankly, there are many factors behind that, but the fundamental one is we know this is where the economic need is. This is where so many of our residents are working every day in essential industries, providing the food that is sustaining our community in kitchens. They're frontline healthcare workers. They're doing all that they possibly can to put food on the table for their families and to sustain our community. And as a result, they are at greater risk. And so we need to ensure there is more testing here in East San Jose to ensure that we are doing right by our entire community. And we certainly have more work to do. So I am thrilled to be here to announce this new expansion of screening criteria here at this site, as well as at the county fairgrounds. And I am, of course, grateful for the continued efforts of the county that has led the country in really flattening the curve here in Santa Clara County. Thank you, President Cindy Chavez.
Well, good morning, everyone. This is a joyful day, and I know we cannot emphasize enough what I'm about to say, which is testing is free and you can be asymptomatic, meaning you don't have to have symptoms, and we want people to get tested. It's so important that you do. The state of California is an incredible partner. They are funding this site. I want to just say a big thank you to them, and to the governor. And I also wanted to say to Verily, thank you so much for stepping up. This is a homegrown business that just stepped up right away when there were others that were so fearful to do that. And not only has Verily stepped up here and at the fairgrounds, but they're helping across the state. This is part of an effort for the county to hit 4,000 tests a day. And part of how we're going to get there is we need you actually to come in and get the tests. I'm going to let Dr. Fensterscheib explain why you should do it and that it's not going to hurt. And you can see people behind us in their cars. You don't even have to get out of your car if you don't want to do that. What's great about this site, you can also walk to it, which I think is very exciting. I want to say again that testing is free of charge, and you can see the website on the podium. If you have a difficult time signing up, you can call any of your elected officials' offices, particularly in San Jose, and we're going to help you sign up. It's really important that you do that. The last thing I just wanted to say, if I could, besides saying the test is free, please come and get a test, is that I really want to thank again Verily. And John Prost is the head of COVID-19 testing and operations for Verily, and I'm just really honored to get to introduce him to all of you today.
Great. Thank you, Mayor Liccardo and Board of Supervisors President Cindy Chavez. I wanted to start by expressing my sincere gratitude to both the City of San Jose and also the County of Santa Clara. In addition to those working on the front lines to help ensure that testing reaches more and more people, especially those most vulnerable to COVID-19. I've honestly been humbled and honored to see the community come together in such a way. Verily's partnership with the state of California to launch the baseline COVID-19 testing program began in March, with a simple goal to increase testing capacity across the state. In fact, the Santa Clara Fairgrounds testing site not far from here was one of the first supported by the state and the Verily platform. This early engagement reflects the commitment that we at Verily share with the leaders standing with me today, and that is to support the public health needs of this community. Verily continues to increase the testing capacity by scaling the program across the state and with others across the country. To date, the baseline COVID-19 testing program has completed over more than 120,000 tests. The community-based testing programs like this one in East San Jose are essential to continue access to safe and effective testing to those in need. Thank you again to the City of San Jose and the County of Santa Clara. Without you, we couldn't have started this. We appreciate your collaboration and leadership, as well as we work to expand to more testing. And I would like to introduce now Dr. Marty Fensterscheib, the Director of Santa Clara County's Testing Task Force. Thank you very much.
Thank you. You did well by my name. I'm Dr. Marty Fensterscheib, and I'm back at work in Santa Clara County so I can help out in this really important effort regarding mobilizing our testing capabilities in Santa Clara County. I want to mention that we are in the midst of a pivot. Up until now, we've been really testing people who have been symptomatic and those contacts of those people who are symptomatic, and now we're moving to testing people who are at risk, who are asymptomatic or without any symptoms whatsoever, but who are in areas that may put them at an increased risk. And as we move towards opening the county more over the next weeks and months, we know that more people will be out and about, and their potential for increasing their risk for getting infected goes up. And so as we do that, the plan is to begin doing a lot of testing so that we capture any of those little fires that flare up, and we start to not only test those people and find the cases, but also find all of their contacts. Because we know that for every case that we identify, there are probably 20 to 40 people that came into contact with that person and may have been exposed. So we're going to be contacting all those people and testing them. In addition to that, we want to test people who are out and about, who are basically that have contact with the public that may not be able to maintain their social distancing. The grocery workers, the people in the pharmacies, some of the childcare workers, people who are actually at work because they're there to basically keep our lives moving and normal, providing all the things that we need. The people that are driving the buses, the first responders, all of those people we want to test because the likelihood of increased risk to infection is higher. Now, the important thing is, why are we here and why are we looking at our hotspots? Our hotspots are in East San Jose. This is where our cases are. Some areas of South County and the Gilroy area, and there's some pockets in the Mountain View area also. It doesn't mean there aren't cases other places, but that's where we see our main numbers of cases. And for instance, I was looking at the data today, and cumulatively, and even of the last couple weeks, 40% of our cases that we've identified have come from East San Jose. And the percent of testing that we've been doing up till now has only been 20% from that area. So we're under testing people from San Jose. That's why we are moving towards mobilizing a lot of work, especially trying to reach people who don't necessarily have easy access to the internet, who don't have cars, who don't understand the language. We're boots on the ground in East San Jose. We will be moving a mobile unit also to places that people are shopping or wherever they congregate, so we can provide testing. This is a work in progress. It's not all happening today, but this is our plan. Putting up flyers, working with community leaders, working with the Community Health Partnership, and making sure that we can have a community-wide effort to get these people tested. That's what's important. And so I want to say that the testing is going to be free. It's going to be easy. And I say easy because we're no longer using a long swab that goes all the way to the back of your throat. That's rather uncomfortable. We're going to use a nasal swab. It will be self-administered. So you will be given the swab for you to swab your own nose. And I'm going to do it. You're going to do it on each side, and you're going to leave it for 10 seconds. I won't do it the whole time. And the other side, 10 seconds, and I won't do it for the whole time. You'll put it into a little container with the viral medium for transport, and that's it. So, free, safe, and easy. And if you look at our website, you will see all of the places that we have testing. You can go to the website, SCC Free Test, My Free Test, and find all of the testing centers. If you don't have internet capacity, you can call 211. And I called it this morning, and they are on board. They will help you find a testing site near you and give you the phone number so that you can make the call to them to set up a time to go in to be tested. So again, focusing now toward the people that are at highest risk. We want the community to, especially those that, again, that are our workers that are going to be at higher risk, to come out and be tested. I'm not so worried about the numbers. I'm more concerned of where we're testing. So that's the most important thing. So that's our message: free, easy, and safe. Come out and be tested. Thank you.
And we're honored, of course, to be in the district of Councilmember Magdalena Carrasco. And we're also fortunate that Magdalena is quite fluent in 2 languages. And so she's been kind enough to offer a few words in both languages. Councilmember Carrasco.
Gracias. Thank you so much. Wow. Thank you to all the wonderful folks that just spoke. And welcome to the beautiful east side of San Jose. I've had the privilege of representing East San Jose District 5 for the past 5 years. But I'm especially proud to be here today at PAL Stadium. This has been the stadium that has seen soccer games, baseball games, movie nights, and the such, serving a beautiful community. Today, we are making history in making sure that this health crisis doesn't continue to impact one of the most vulnerable communities not just in San Jose, but really in the entire county. And as I'm going to call him Dr. Marty. As Dr. Marty just so eloquently explained, this is really the area where we need to make sure that we focus our attention. Of course, a pandemic understands no boundaries, but this is the vulnerable community, our essential workers, folks that have little access to medical care, who have to continue to work because of different conditions, and we have to make sure that we make testing accessible every which way, breaking down barriers, making sure that they understand that the testing site is here accessible to them and that it's free, so that we can control the contagion, and that we make sure that we provide the resources that they need so that they are healthy, their families are healthy, and that our community, city, and county remains healthy. Unas cuantas palabras en español porque creo que es sumamente importante que nuestra comunidad entienda que aquí tenemos uno de los dos sitios que Vera Lee, el estado y el condado y la ciudad se han aliado para poder proveer los servicios a nuestra comunidad, a nuestros residentes, totalmente gratuito. Como lo acaba de mencionar el alcalde Sam Licardo y nuestra supervisora Cindy Chávez, esa es una asociación que se ha hecho con el fin de controlar el COVID-19 y el contagio. Este es un servicio totalmente gratuito, con o sin aseguranza, con o sin síntomas. Hoy se está iniciando este programa para poder ofrecérselos a nuestra comunidad, a nuestros familiares, a las personas que todavía siguen trabajando, a aquellas personas que viven en hogares multigenerales, y lo vamos a hacer de la manera más fácil. Se tienen que registrar, tienen que hacer citas, pero pueden llegar a estos sitios sin coche, y es una prueba que se autoadministra. No duele, no se les cobra. Las pruebas son dentro de unos cuantos días, pero se está haciendo porque sabemos que en estas comunidades van a ser las comunidades más impactadas de todo el condado de Santa Clara. Le doy las gracias a muchas de las personas que se encuentran aquí, principalmente al alcalde y a la supervisora, pero le doy las gracias también al doctor Marty. Pero también le quiero dar las gracias al señor Kip Harkness, Rob Lloyd, Walter Lynn, al señor John Probst, a Javier González, que ha sido increíble en coordinar todo esto, a la doctora Sarah Cody, y claro, pues todo al equipo de la ciudad y del condado por la coordinación que se está haciendo aquí. Es una maravilla, y tenemos que hacer todo lo posible para que nuestros residentes se den cuenta y se enteren de que las pruebas aquí están totalmente gratuitas. Gracias. Y con eso les presento al concejal Lon Diep, que también tenemos el honor de que pueda hablar no nomás el inglés, pero pueda comunicarse con nuestros residentes vietnamitas. I'd like to introduce our council member Lon Diep, who not only is very fluent in English, thank goodness, but he has an ability to also reach out to our Vietnamese community, who of course we know we're trying to make sure that they also understand that these services of course are open to everyone, but especially our Vietnamese community who lives in District 5 and in the entire east side of San Jose.
Hello everyone, thank you Councilmember Carrasco. Hello, I'm Councilmember Lon Diep, and I just want to add that as the entire nation ramps up on its testing and counties and cities step up to do more of it, I'm especially proud that we in Santa Clara County and the city of San Jose are doubling down on our outreach to limited English proficient communities, Spanish speakers, Vietnamese speakers, Chinese speakers, who even in good times often get left out and don't always have access to the benefits that are easily available to everyone else. So with that, I'd like to make some comments in Vietnamese. Kính thưa quý vị, chúng tôi là nghệ viên Diệp Thế Lân. Hôm nay cái mục đích của buổi họp báo này là để thông báo với mọi người là quận Santa Clara, thành phố San Jose, qua cái sự lãnh đạo của Chủ tịch Ban Giám sát quận Santa Clara Cindy Chavez và thị trưởng San Jose Sam Licardo đã hợp tác với tiểu bang cũng như cái công ty Verily để kể từ nay cho mọi người sống tại San Jose xét nghiệm COVID-19 miễn phí. Quý vị không cần có triệu chứng gì cả. Nếu quý vị thắc mắc về cái tình trạng của mình, muốn biết thì cứ đến cái trang web projectbaseline.com/covid-19 và đến đây lấy hẹn. Tại San Jose chúng ta có hai địa điểm để có thể xét nghiệm từ 9 giờ sáng đến 3 giờ chiều, thứ hai đến thứ sáu. Một là ở Santa Clara County Fairgrounds và hai là ở đây là cái Powell Stadium. Cả hai nơi là cũng gần cái khu phố người Việt Nam chúng ta. Santa Clara County Fairgrounds thì mọi người chúng ta đều quen thuộc. Cái nơi Powell Stadium này là cái sân vận động này, nó cũng không quá xa cái đường Little Saigon, khu Little Saigon của chúng ta, đi từ đường 680 exit đường King là nó ngay đó thôi. Cho nên quý vị có thể đến đây lên trang mạng xin xét nghiệm miễn phí. Quý vị không cần có bảo hiểm, không cần đóng một đồng nào cả. Quý vị chỉ cần trên tối thiểu là 18 tuổi trở lên và đồng ý ký một cái mẫu đơn cho người ta xét nghiệm mình thôi. Và như bác sĩ vừa rồi có hướng dẫn, chỉ lấy một cái cây đút vào cái mũi của mình khoảng 10 giây, xoáy rồi cái trả về thôi. Cho nên nó rất là đơn giản, rất là miễn phí, rất là tiện nghi. Cho nên nếu quý vị muốn biết thì xin cứ đến projectbaseline.com/covid-19. Xin cảm ơn.
Thank you, Councilmember Diep. And just to reiterate, you can get testing here in San Jose and Santa Clara County. Just go to sccfreetest.org. You don't need money, you don't need health insurance, and you don't need symptoms. Just come on down and get tested. Now we're happy to take questions. Any of us are. If there are any questions for the group in any language. Hi, Len.
Yeah, I have a question. What is the overall percentage of testing in Santa Clara County? And secondarily, do you run the risk of making this an East Side San Jose problem when the people who work here work all throughout the county and beyond?
It's a total, yes, the issue of where the problem is, the issue is that we have an issue in our total county is the issue. And we have to focus on the entire county as far as getting the message out, because we have healthcare providers, we have a lot of people and other clinics that are providing testing. But when you look at where our cases are and where the people live that are working all over the county, that's where we have to focus, at least providing the information in appropriate cultural languages and providing testing that's easy. Because again, if you're working, maybe you can't get off work to go be tested. So we want to make it easy and available close by. But yes, people that are living in certain areas at East San Jose are certainly working in all aspects of our county. We're again just revving up our numbers. We want to get to a higher number. I'm not going to focus on that 4,000 number, because as I said, it's more important to test the people at highest risk as opposed to testing low risk people who perhaps live in wherever areas in Santa Clara County. So again, focusing on the highest risk people and get as many people tested as we can. We will increase our capability as the demand increases. So we want to get the demand going so people get out there and get tested. So the question was, again, frontline workers, how do we do it as a one-time shot? Good question, because no, they're constantly working. So we are recommending a frequency of once a month for those frontline workers, that they get tested and they get tested again. So you can't just do it once, you have to do it on a regular basis. And that's why it's important for the employers of the workers to understand that it's really important for them to work with us and their employees to provide time for those workers to go and get testing.
Marty, should people kind of brace themselves for an increase in numbers that they might hear as the testing goes up? People probably get a little bit scared if they start seeing a spike. Will that just be a reflection of more testing?
Right. As we begin doing this, again, as we begin opening up more, then people are more exposed. The idea is that we may have more tests, we may identify additional cases, and so we expect that. And so the idea is that we can quickly test the cases, and as I mentioned before, test all of the contacts of those cases, keep it contained. We're moving back into kind of a containment, and so then we can put out these fires. But expect some additional cases as we begin to open up.